Richard Fuller.
Thank you very much, Madam Deputy Speaker, and it's a pleasure to follow the Honourable Lady, the member for Liverpool Wavertree, and her comments. My observations are based on having spoken with, over the last 6 months, spending mornings with about 11 of the 13 networks of GPs in my constituency, and some of their observations, which I've shared with the Minister previously. But part of the issue in my area is that the population has grown so significantly. So really since 2000, the number of patients per GP has gone up about 40% through the constituency, and that puts significant pressure, which GPs are responding to, primarily by recruiting other direct care professionals, such as paramedics and various qualified nurses. That has a role in supporting the problems, but it hasn't overcome quite a significant efforts that people have seen of my constituents to be able to contact their GP. One of the issues that was really rather interesting in those observations was that the choice of a phone system by a practice had such a significant effect. Certain practices that chose system A, let's call it, I don't want to say a bad word about a particular practice or a particular phone system, but they would find that the response for the customers, the patients, was terrible. That effectively they would get a signal at the end of when 10 people were on waiting that the 11th caller, the number was no longer obtainable. And so then they would go to the practice. Now this is, remember, just after COVID, and they go to the practice and try and get in, and there'd be a big sign on the door saying no entry. And so these are very easy to understand problems that occur that can't be solved by the government, but do have a very direct impact on the experience of primary care for people. But there are aspects which can be affected by government. One of the biggest concerns in my area has been the level and pace of housing development and the absence of a infrastructure-first policy. And I'm going to ask the Minister in her summit, can she just update the House on her conversations with the Department for Local Government about implementing infrastructure first? Infrastructure first means that before a large-scale housing development can take place, the GP services and the school places need to be there. Not that people move into their new house in some of these estates and then find there are no GP places, there are no school places, there are no dentists. This was a manifesto commitment of my party. It's one that we should be putting into a law. And I'd also say that the comments that have been made by my honourable friend, the member for Sheffield Central, about dental contracts also goes for GP contracts. And there seems to be a confusion in the NHS. I don't think, and the Minister is quite clear, this is not really a government responsibility, but there's confusion in the NHS about whether there is value to the partner model amongst GPs, or whether we should be moving for a salaried model and essentially say we're not going to pay extra for partners. This is an area where I think the government needs to set some direction of travel. I think it is an important direction to set for the NHS. I have my views, but I'd be interested to see if the Minister believes that is something that she can do. Something that's been on my mind this week particularly has been the sclerotic process in NHS estates and others for actually getting primary care facilities built. BBC Look East yesterday carried a story about the new primary care facility being built in Biddenham, in my constituency. 8 years since it was first planned. We're hoping, fingers crossed, Madam Deputy Speaker, that that building will be commenced. And that's because, obviously, a lot of people had an interest. The GPs had an interest. The CCG had an interest. NHS estates had an interest. The local authority had an interest. The housing developer had an interest. The developer of the facility had an interest. But who was making the decision? The NHS needs to recognise that in the provision of services, it's got to be clear on who is saying yes, when, where and how. And in my own constituency, and I'm very grateful for the Minister for saying that she'll conduct a backward review on the impact of if infrastructure first had been in place, there are issues also in Great Barford, where there's a cramped surgery, but there's a perfectly good, agreeable building opposite that's been identified to which the GP practice can move that will provide better facilities. We have in Alsey a significant increase in population, but the GP practice is en route. I was there myself just 2 weeks ago, Madam Deputy Speaker. There's no air conditioning. There are doors in that mean you could walk directly into a GP whilst they're doing their session with a patient. That facility needs upgrading. We need decisions on that. And in Biggleswade, I am told that my local authority, Central Beds Council, have the money ready to convert a site to primary care, and yet the decision process within the NHS are not making that able to happen. These planning processes need very urgent attention by the government if change is to be made. Now, we've talked about diversity of primary care roles, and that's one of the positives, I think, of the government, and the government have said that they're going to increase the number of those roles, such as emergency care nurses and other types of nurses and paramedics. We also saw the government's paper this week on data saves lives and the way in which better use of data can assist in providing solutions for people. That is both in terms of, and I take the criticism from the shadow spokesperson about the NHS app. I mean, come on. I mean, this is not, I was going to say 19th century, it's not quite 19th century, but certainly 20th century in its user-friendliness. So what is the plan? Not only to harness data, but also to make it accessible for people, to put power in the hands of the patient. If you know that you can do things with information about yourself and about your health, that you can connect it quite rightly to how many steps a day that you're taking, or something that connects with maybe you are a diabetic and you have information you need from your testing for that. This is a world of improvement to empower individuals in primary care. The first port of call in primary care provision is each of us. Each of us managing our own healthcare. And what better way to do that than trying to follow some of the examples from the rest of the world in terms of NHS applications. Can I also have an update from the Minister about the use of artificial intelligence and big data on those larger aspects, particularly when it comes to preemptive screening? The government's making very welcome investment in screening centres, but how are we harnessing all this medical data that we have to that task of improving care and health at a preventative level rather than later in the day. And finally, if I may just make a point, my honourable friend, the member for Winchester, has left, but he's absolutely right that the government is on the right course by opening up more points of presence for primary care, by bringing in pharmacies, bringing in screening centres, so that each of us as individuals can make the choice of where we want to go to get some of the services that we want. I would just say to the Minister, it's important that legislation and regulation follow as permissive an approach as possible. Let's focus the regulations on the patient and the patient choice, not on provider and provider restrictions.